Hi, my name is Saghir Ahmed, Superintendent of Imaan Healthcare and Operations Director for Green Life Pharma. With me, I have my colleague Ghulam Haydar.
Hi, you all right? Saghir,
Uh,
good morning.
let's give an intro of yourself, mate.
Yeah, my name is Ghulam Haydar, and I am the services lead for Green Life Pharma.
We thought we'll just do this Q&A session because there were some questions that were coming directed at us, mainly to do with what coronavirus COVID-19 is, how it affects different people, but also what have we done as a business in terms of our pharmacies and the office, how we've adapted to current requirements, but also what have the pharmacies done and what can the general public expect? I suppose not just from our own pharmacies, but I think this will be quite applicable for every pharmacy up and down the country. So, shall we start?
Yeah, sure.
Okay, so first question, Gulan, can you start?
Yeah, yeah. You asking me? Am I asking you?
We've got the questions that have come up, so do you want to read it out and then you can start responding?
All right. So, how does the actual virus spread? Seems to be some level of confusion out there. If it's airborne, if it's droplet borne. So maybe, Saghir, you can shed some light into that.
Yeah. So the virus is spread mostly by airborne droplets. So what we do know is that once you get the virus, it incubates in yourself for anything from 1 to about 5 days. So you will have bits of the virus at the back of your throat and in your nose before it starts dispersing into your lungs. And when you cough and you sneeze, the particles become airborne. And that's where you can catch it either directly for those droplets to land on somebody or to drop off on surfaces. So, such as this table over here, if I was to cough or sneeze and I had droplets that fell onto the table, and the next person was then to touch it. And one thing that uh, we have learned during this period, which I think many of us have never really took much attention to, is the amount of times that we all touch our face
Yeah.
in any given time. Uh, I'm very guilty of it. I'm very much somebody who'll start scratching their chin, their nose, their eyes. I don't even realize I'm doing it, but when the fact is that I could be touching any sort of viruses or particles, and as soon as I start doing that, I'm significantly increasing the risk of those particles going into my mouth, my eyes, my nose, and that's how the virus really spreads. You know? But we can mitigate that by making sure that we wash our hands. This thing about washing your hands and doing it on a regular basis, it is very important because what we do know is the virus is um, is encapsulated in a lipid layer.
Yeah.
So when washing your hands with soap and with warm water, and also to be able to do it for at least 20 seconds, helps to break down the virus and to get rid of it as well. So I know it's uh, a thing that's been said so often now about washing hands, but it really is the best form of defense that we have, and it is the most single important take that we have had from from these past few weeks. I suppose the other thing, Glam, I'd like to know your thoughts on this, but how effective or how important do you reckon it is to be wearing face masks?
Yeah, that's obviously something that we've been impacted by in healthcare. So there's it's not about how impactive face masks are. It's about the right face masks. I mean, everyone over the last few weeks have their knowledge on masks have increased exponentially. Most of us didn't know the difference between 3-ply and KN95 and N95s. I mean, most of us would have thought they're mobile phone models a year ago. But they are effective in terms of when you are in close contact with somebody and you are having to treat them or you're in a consultation with them. All healthcare professionals have been advised to wear them in consultations or if they are doing any procedures, because those droplets that can become aerosolized and you can easily breathe them in if you're in close proximity to them.
Yeah.
So in terms of wearing them in a professional capacity, yes. In terms of which ones should you wear, there is some discussions about that. I think the N95, which has the valve on it, seems to be the best one, but they are in short supply. The 3-ply ones that community pharmacies, for example, have been provided with, and lots of GP surgeries have. They're generally okay to wear as well if it's just in the form of a consultation as a precautionary measure. But those that are working on the front line with diagnosed COVID patients, they obviously those masks won't be sufficient for them. They require a different level with the whole PPE kit as well.
Mm.
So, but in terms of the general public wearing them out on the streets in the supermarket, I personally don't know how effective that is, because you're not really, if you're keeping your distance as has been advised by the government and everybody out there in terms of at least 2 meters, if not more, then in reality you won't need to have a mask because you're not coming in close contact with somebody. However, it makes people feel a bit more secure psychologically. They feel like they're doing something. So I think from that perspective, I wouldn't knock it. And I have another charity, and we have our charity volunteers that do wear them, and when they're making the isolation drop-offs for food items, and it makes them feel a bit better and secure. So again, if that has a contributing factor in terms of how they feel, then I'm for it. But in terms of practically, I don't think it has that much if you're not coming into close contact with people, and we're hoping that people aren't coming into close contact with anybody other than those in their household anyway.
I suppose my take on it is that in urban areas, city centres, you're more likely to be in close proximity to others,
Yeah.
especially on public transport.
Yeah.
I can actually see how how people wear it on a regular basis in the Far East,
Mm.
it's like Hong Kong and China and Japan. I can see it becoming a bit more common here in Europe as well.
I always thought that was to do with pollution. I never really realised it was to do with protecting yourself from infectious diseases. We always
Yeah,
used to
no,
see people wearing it around the city centre, mainly tourists from the Far East. But
yeah.
yeah, I think you're right. It will catch on. I think it will become almost a norm in society once this pandemic is over.
I'll tell you something on a personal level. What I've done, I've ordered some face masks for uh, me, my wife, the kids.
Mm.
The ones I've got for the kids, they're not in yet, but they've got some sort of pattern on it, and it's a bit. I like, but I suppose what I'm saying here is that there's they might just become a bit more of a common accessory.
Yeah, definitely.
I personally bought them because I would feel a bit more secure wearing them out, and as well with the kids wearing them. My wife thinks totally different to me. She thinks it's not necessary at all.
Yeah, well, it goes back to what I said earlier. Like,
Yeah,
if it makes you feel a bit more secure, I
but
think
why not?
that is enough of a reason to wear them.
Yeah,
Yes, you might, as you mentioned, some areas are a bit more densely populated than others. So if you're on public transport, you're in the city centre, you're likely to become in close proximity to somebody, even if you are trying to keep your distance from them.
yeah,
But generally, let's say you're going for your once a day walk, as has been allowed by our government for exercise, then we're hoping that there's not many people out on the streets, and you have enough distance between yourself and the next person who you're walking behind or in front of. So
mm,
it's not going to be that effective in that scenario.
Yeah. Cool. Okay. Let's go on to the next question. We've got
Yeah.
here. Why are we seeing a rise in cases? Well, we're not seeing the rise in cases that we were expecting. It's starting to fall a bit now, hasn't it?
Is it? I don't know. I thought we haven't reached the peak.
Well, it is a little bit confusing because last week, about a week ago, we were hitting just under 1,000 deaths.
Yeah.
Now we are hitting around just under 800 deaths. I know
Wow.
that doesn't include any figures from care homes. These are only deaths in hospitals, so the figures are misleading.
Yeah, so they're registered deaths in hospitals and not care homes and individual homes as well. So we don't actually know the true figure. And I mean, I watched a few YouTube videos of Piers Morgan hammering some of the cabinet ministers about the stats, the real stats, and they couldn't provide an answer. So he was quite livid, to be honest with you. So yeah, we don't. That's in terms of deaths, but in terms of transmissions, we unfortunately we don't know the real figures because unlike other countries, we're not doing widespread testing and contact tracing. So we're going by the general advice that if you have a temperature and a new continuous cough, to isolate for 7 days and for the household to isolate for 14. Now, on that, these people who are expressing new symptoms, they're not being tested, so we won't know really the reality of how this virus has spread through the country. We just won't have that accurate figure. But anecdotally, we do know that the virus has spread significantly, and people are expressing symptoms, even though they might not have been tested. And the reason for that is simple. It's a virus that there's no immunity to. It's a new virus that's evolved from a previous virus, and there's the level of transmission is out there. It's transmitted from one person to another, and if you do get that virus, you will have a response to it. Unlike the common cold or the flu, you might have some level of natural immunity to it, or through vaccination. So that's why the level of transmission is going to be high, and that's why it's a global pandemic, because there's no immunity to it yet, either natural or through artificial means via vaccination.
One thing that has been interesting, though, again, speaking to the wife who works in hospital and to other friends, the number of cases that they have in ICU and critical care wards in hospitals is a bit stretched. But what I'm hearing is that they started clearing wards, other non-COVID-19 and non-ICU wards, a few weeks ago, on the expectation that the numbers are going to be increasing of patients who might be expressing symptoms.
Yeah.
Which has, but they've not been getting the admissions of patients with other conditions in the same numbers as they were expecting.
Yeah.
So the medicines admission units, Alison was saying it's quieter than normal.
And do you know the reason why, Saghir?
What do you think? Yeah, go on.
I kind of know the reason why from my general practice hat on.
Yeah.
So, two reasons. One is patients themselves are reluctant to go into hospital at the moment.
Yeah.
Because they fear that it's a hotbed of COVID, and if they go in, they're likely to contract the virus. And the second thing is, in terms of appointments, referrals from primary care, i.e. GP surgeries, they're not referring in the numbers that they were previously, based on for two reasons. One is that they're assessing on a level of urgency. So if it can wait, they're adopting like a wait and see approach, like a delayed tactic. And two, the guidance seems to be changing every day. It is a little bit confusing, even for those that are working in general practice. But on one hand, I remember a guidance that we read a week ago, which is that if it's non-urgent and it can wait, and they gave a list of what is classified as urgent and not, wait. And then the next week after that, the guidance was, you can still refer, but we don't know when the referral dates will come through, etc. So it's just all a little bit confusing. And then from the perspective of those outpatient appointments in secondary care, most secondary care appointments had been cancelled initially. The face-to-face of those that are on see a consultant, let's say every few months, every 3 to 6 months for their bowel condition or for whatever, for their cardiac condition, they all got cancelled. Some of them got switched to phone appointments. So people aren't coming in for all those reasons. And yeah, there is definitely a fear from our patients, both in community pharmacy and general practice, that they feel that they don't want to go to hospital.
Yeah, and I get that. What I'm now feeling, or I think there might be a concern here. I don't know whether you share this as well, but are we increasing the risk of people who should be admitted into hospital, who aren't being referred into hospital, and there being significant harm to them,
Yeah,
the community?
yeah. There's going to be a backlog, Saghir. Like that.
Yeah,
That's the fear. Like, do you know? Basically, if you think about it from a common sense perspective, if you've got a condition, Saghir, that
yeah,
needs to be seen urgently or within at least the next week or two, and you're delaying it,
yeah,
that condition's going to get worse,
yeah,
right? And then by the time all this is over, and we don't even know when it's going to be over, the
yeah,
system is not going to be able to deal, number one, with the backlog,
yeah,
and number two, their condition that they would have presented with 3 months ago would have been a lot less complicated than what they presented months later,
yeah,
right? So that's the worry now, and these are some of the conversations that are taking place, which is, yes, there is a calm before the storm, but let's even define what the storm is. Is the storm a COVID storm, which is a storm, or is there a second storm that we need to think about, which is we're going to have to be dealing with a host of complicated chronic conditions, and there's just going to be too many presenting at the same time, and do we as the NHS have a system in place to be able to deal with that? And obviously we all have our opinions on that.
There, people are having the debate in primary care about that backlog of work.
Yeah, definitely. We had a practice meeting yesterday about this, which is when we started getting patients coming in, both primary care are gonna normally stuff that secondary care would have dealt with, because they just won't have the capacity of the backlog. That's going to fall into primary care. So these are the more complicated cases that would have normally been referred to secondary care, and secondary care just won't be able to deal with it as well. So it's gonna be like, I fear like what's gonna happen in a year's time, or probably sooner, in terms of the healthcare service dealing with non-COVID cases that we would have dealt with on a normal day-to-day basis. And we know prior to this, the NHS was stretched anyway. So how we're going to deal with all of these cases is it's going to be challenging. Yeah, I've got it here. So it says, "Hi, Saghir and Ghulam. I'm at home self-isolating with symptoms. I'm awaiting results of a swab test." Wow, well done. You've got a swab test. It's like a lottery now. "And I feel lousy with the cough and all over aches and pains. I am limited to paracetamol and ibuprofen that will help symptoms. PS, thanks for the live Q&A. Am I limited to paracetamol and ibuprofen?" And Whiteside. Are you limited to it? Well, it depends what your symptoms are. Because if the symptoms are fever and a cough, a sore throat, you deal with it on a symptomatic basis, and so you would deal with the fever with a paracetamol. Pain, likewise. If you do have a sore throat, you can take some sort of lozenges, and you can maybe take some spray. If you have a dry, irritating cough, then you can have a cough syrup. But if it is the virus, and it's contained, and the symptoms don't progress, then those options are okay to take. However, I just want to, it won't deal with the virus. It isn't an antiviral. It won't kill the virus off. So it's your own body's natural immune system that you're going to have to rely on, like with all viruses, to get rid of the virus. So hopefully the symptoms just stay mild, and they don't progress, and just take the advice that's out there on NHS 111, which is to isolate, treat the symptoms, make sure that others in your household are isolating with you, so they're not going out for a period of 2 weeks. And if you have friends or family that can drop shopping off to you or any other urgent medical supplies, get them to do that. If you don't, I think there's lots of different community groups, and even on NHS 111, they have links to people in your area that can do that for you.
I think it's really important to stress as well that if you get symptoms, the chances are that you're going to be okay. Right?
Yeah, definitely.
I know there's heightened anxiety with the thought of having COVID-19 and what that can lead to, but by and large, most people do fight the virus. Their immune system is able to withstand it and develop immunity over a matter of days. So what tends to happen is you get the cough, you get the fever, you get this general fatigue. A lot of people have said that they just feel absolutely worn out with it.
Yeah.
But that tends to subside after about 3 days.
Yeah.
And as Ghulam, as you said, just to take the paracetamol on the ibuprofen, just to be able to reduce any sort of inflammation and to reduce that temperature when you get a fever. But you've got to give your immune system a chance to be able to fight the virus and develop that immunity. And after about anything between about 3 to 7 days, you tend to feel okay.
Yeah, definitely. I think what's really not helping the sort of PR out there against this virus is that we're only hearing about the worst cases, and those are the cases of coronavirus where people are going into the hospital. So I'm glad, and in this case, has been tested or the swab's been taken, because then at least we've got a number of somebody who, let's say does come back as confirmed, and then she does recover, and we hope, and I'm sure she will do. Then that's a case where we can highlight, like, look, someone was confirmed as a coronavirus case. She isolated at home. She had some mild symptoms, and then she recovered, and now she's fine. And we're not hearing enough about those cases, unfortunately, on the scale that we would like. Maybe it's just the nature of people on social media and on the news. We always hear, who hears of good news on the news, right? But there are many cases around the country where people have had the virus and they've been fine. They've had mild to moderate symptoms and recovered.
Well, it's not going to be on the news if it's not dramatic.
Exactly.
Both cases are not dramatic. Yeah. We both thought that we might have had COVID-19 symptoms, so both of us have had to isolate for about a week.
Yeah.
If I had it, my symptoms were very mild. I had a cough, a dry cough. Saying that though, for 2 days in the morning, I was coughing up something, but it was only for 2 days.
Yeah.
I had a fever for 2 days. But it wasn't.
Did you have night fever?
No, it was during. Actually, yeah, it was in the evenings.
Did you do the dance?
No, I didn't do it. I just wrapped myself up. But after about 2 days, I started feeling okay. Yeah. But it was important. This is where it was quite important that we isolate as well.
Yeah, definitely.
So I was able to sleep in a separate room. I was able to have one bathroom. We have 2 bathrooms, so we're quite fortunate to say that one bathroom I was just going to use.
Yeah.
And also making sure that I have to go into the bathroom, be it for whatever, to wipe down with Dettol and keep the place clean, and to separate myself properly from the wife and the kids. I know it's hard because you do it for a day, you do it for 2 days or 3 days, but then it becomes quite onerous. But it is really important that you do so. But saying that, before me, we felt that my wife had the same sort of symptoms a week before I did. We felt that my little boy, the 6-year-old, he might have. And I know one of the questions is, are the symptoms different to children than to adults? Well, what we do know is when children have it, the symptoms do tend to be very mild. And if my boy had it, he had a cough, which seemed to persist for about 3 weeks. He couldn't get rid of this cough, but he wasn't coughing up anything.
Yeah.
And for about a week, he had this general malaise to him. You know how he's
Quite
always
authentic.
he's zipping around here, there, and everywhere. But for about a week, he just felt so about everything. So we don't know whether that was COVID-19 related.
Mm,
But saying that though, you have these sort of symptoms. You try to sort of piece things together, and without having that tested,
yeah.
you just really don't know. We used to say that it just wasn't any other normal bug that goes around, and then we just passed it around each other, and it's not COVID-19 at all.
Yeah.
But there
All
you
right.
go.
Should we do the next question?
Yeah, where are we up to?
I don't know, we're not doing well. About a take. So, can the virus be spread through food? For example, ordering a takeout. That's question number 3, by the way. So we're doing terrible.
I think well, some of the other questions we've covered as well, though.
We have. It's a discussion that will cover a lot of the questions.
Yeah,
Um, this is Parlin, who's actually hosted us, is a big foodie, as am I, and takeaways has been a big issue in terms of should we go and get a takeaway from Just Eat or Deliveroo, or should we
yeah,
just eat at home? Luckily, my wife, she's had to she's been working from home throughout this period from the university and museum. So she loves cooking. So I haven't had to have takeaways, but it's a good question. It's a good question. I mean, generally, most places are hygienic. They have good hygiene ratings, and they're cooking. They're taking extra precautions during this time, so it's not an issue. But on principle, where you can, I would say eat at home, eat yourself, cook your own food because you know how clean your own measures are compared to somebody else. But if you trust a place, like you did previously to the pandemic, I don't see any. I don't see why you wouldn't trust them in this case as well. That's my own personal opinion. Because yes, it can be spread on food if somebody, for example, was to sneeze on it, or they didn't wash their hands and they had it, and they were touching food. But they wouldn't be doing that if some of these places that you would have previously bought your food from or had it delivered to your house to. That's my own take on it. Again, I
no,
don't know.
I agree. I think what's happening now because you're not going out.
Yeah,
The one treat that you have, or we have, is on a Saturday evening where we order some takeout,
yeah,
right? But we always order pretty much from one or two places
yeah,
because you have that sense of trust of um, how know how compliant they are with hygiene as well. And
yeah,
all restaurants and takeaways they have their hygiene ratings as well, which you can find out. But you have a level of trust with some places.
yeah.
If you're ordering from here, there, and everywhere, as you just said, you just don't know.
Yeah, I would say the sensible advice is don't order from somewhere new.
Yeah,
Order if you've been going to your regular joint as Saghir obviously does on a Saturday night, right? Carry on if that's what makes you feel better, and you like the food, you know, and if they're delivering, great. If you need to pick it up, you can go and pick it up as well. As long as you trust them, and you can ask them as well. If you want to know what extra precautions they are taking, just be upfront and ask them. I know I've got a couple of friends that have food places, and they've got like a 5-star hygiene rating anyway, but they've ramped it up in terms of between each meal they have to like wash their hands or wash their gloves, what they're using with disinfectant. They have to spray everything down, wipe everything down, and then even when they do their delivery, the delivery drivers have hand sanitizing gel, and they before they're allowed to touch the bags, they have to wash their hands or disinfect their hands, and then after each delivery they have to do that as well. So just ask them if you're unsure.
cool. Okay. Should we move on to some more pharmacy related questions?
Yep.
I'll throw this one at you. Can I order my prescription early to avoid going out?
I would say no. In this case, don't order it early, because if everyone orders it early, it just creates a backlog, as we've seen in the first couple of weeks of this outbreak, or when this country started taking it seriously. So what I mean by that is there's obviously, every business, every pharmacy plans for its workload, and as a result of that, they assess their staffing levels on a day-to-day basis, and what their delivery threshold is going to be like, and load is going to be like. Sorry, and too many prescriptions coming in early or in increased quantities means that the pharmacies are not going to be at a place where they can cope with that workload, on a normal in a normal day-to-day sort of basis. So I would say no, don't order early, because pharmacies are staying open, as you've seen. GP surgeries are staying open as well, so you will get your prescriptions when you order them, and you will have the prescriptions assembled, dispensed, checked by the pharmacy team, and either you can pick it up or deliver it like you would on a normal basis. You are allowed to leave your home for exercise or for shopping and going to your pharmacy to pick up medication. So none of these things have changed, and it also enables pharmacies to be able to order stock in a sort of gradual manner. So what's happened now is, because of the initial surge of prescriptions that were coming through, the wholesalers couldn't cope with the demand from multiple pharmacies ordering, like wholesale stock to sort of furnish their prescriptions. And as a result of that, patients became became panicked. Oh, like, I might not get their medication. I might not get my medication because, look, pharmacies can't get hold of the supplies. But it was artificially created, just like the whole toilet paper issue. Now, if you go to the supermarkets, they're full of, all the aisles are full of toilet roll. But initially, in the first couple of weeks, you went to all the supermarkets, all the toilet rolls aisles were just empty, all the pasta aisles were empty. It's because we artificially created a situation where people were just buying, hoarding, and the sort of deliveries couldn't meet the demand. So we don't want that situation in community pharmacy. People will get their medication. There isn't a shortage of medication in this country, but what there could be, or what has happened in the first few weeks, is that the demand from the wholesalers, the request that the pharmacy is making from the wholesalers, they haven't been able to provide it quick enough, which has then created unnecessary panic that just didn't need to be there. So that's my take on it.
Yeah, I think it's been exacerbated as well by the GPs trying to get themselves organised as well. They weren't. I think they were doing this out of being prepared, because they were expecting primary care to become ridiculously busy as well.
Yeah.
Well as secondary care. So the instructions were to be able to get repeat prescriptions done and make sure that everybody's got their provisions of meds.
Yeah. I know, Saghir, that general practice have allowed for a few more working days for the patients to order a bit earlier. But what I mean by early, it's just like, normally I think it's around about 5 working days that they're allowed to order early, but now they've allowed for 7 working days, as an example, just so that the pharmacy have enough time to order the stock in and get it all ready. But I wouldn't order 3 weeks early or 2 weeks early. It doesn't make sense. You are going to get your medication. Your pharmacy is not closing down. GP surgery is not closing down. You will get your medication, and the wholesalers are all open as well. We're getting our daily deliveries in, so this shouldn't really be an issue.
Yeah, but what we're also seeing is, because the prescriptions have been done early, so the customer expects or has been told that the prescription would be arriving at the pharmacy a bit sooner. Then that backlog of work, what we've seen is, over the past month in some pharmacies, there's been an increase of anything between 20 to 40% in dispensing activity.
Yeah.
You have that amount of work. What you also have is, you've got X number of staff, but you've got, in pretty much every pharmacy that we have, there's at least one person who has to be off, because either they're displaying symptoms of COVID-19, or they've got family members in their house who are displaying COVID-19 symptoms. So you could be one person down.
Yeah.
what we've also experienced is the amount of phone calls that you get. So you pretty much take one member of staff out because all they're doing is responding to the phone.
Mm.
Then the other measures we've had to put in place in regards to social distancing and keeping that 2 meter distance between each of us. We only allow one person or one customer to come into the farm at one time.
Yeah.
So then again, you've got one person on the counter who's pretty much opening and closing the door and allowing that person to come in. So you create this line of customers who need to come into the pharmacy, and it slows things down. But you've already taken out a few members of your team to be able to get the dispensing work. So the dispensing work has also increased quite significantly. But you're putting more stresses and strain on the existing pharmacist and their staff to be able to process everything as well. So that also exacerbates everything being a bit slower than what the customer really needs it to be.
Yeah, definitely. And I think we've got to give props to all the community pharmacy teams out there who
Yeah.
have been coming in early and staying behind late and staying open, well, not open on the weekends, but coming in behind closed doors on the weekend with the pharmacists to catch up on the work, to make sure patients are getting in their medication. And they've been doing this out of, their own goodwill, really.
They've been amazing. This has been the toughest period that I've ever experienced in my career, in my 17 years as a pharmacist. And but what I've also seen is I've seen people who are generally scared and worried about their own health and well-being, about coming into the pharmacy and being exposed to so many people, because we have had people coming in coughing and scared that they might have COVID-19 symptoms, even though if you do, you're supposed to isolate straight away. But because of anxiety, you're looking for some help. You're looking for a healthcare professional just to be able to give you some advice. And we've had to send them home, close the pharmacy, deep clean the place before we can allow other customers to come in. And we've got staff who are generally scared about their own health and well-being.
Yeah.
But I have seen a level of dedication that has been quite outstanding by these guys to come in, day out, to come in early, to leave late, to come in on their days off, just to be able to get the work done, because they have took it upon their own responsibility to be able to do whatever they can to be there, to be that piece of cog in the whole healthcare apparatus.
Yeah.
So I know there's a lot of things that the general public don't necessarily see, and which is fair enough. How can they notice that? But these guys have gone above and beyond for the patients and communities that they serve, just to be able to say that, okay, our job here is to make sure that we're getting the necessary medication out to those patients, and there's no delay, because the last thing we want is to be delays to provision of meds, and that person's condition to worsen, or you've got patients who are more at risk of getting COVID-19, and the repercussions of them getting it are much greater than others. And we don't want those people to suffer. So I know there's been greater appreciation of the general public of what pharmacists and the pharmacy techs and the teams are doing. But I really do hope that during this period of time and beyond, people have a greater appreciation of what their pharmacies do. And it's not just about providing medication to the general public, it's providing that information on how to get the best out of the meds. It's about information on public health, which I know both of us believe that pharmacy could do a heck of a lot more if supported by NHS England and the area teams. But truth be told, they have been fantastic during this period.
Yeah, definitely. I mean, even I know of pharmacists that have been doing deliveries themselves, and it's not in their job spec. They've been behind and doing deliveries, and I know that from the surgery where I work. One of the reception staff, she lives next to one of the Imaan pharmacies cathedral.
Yeah.
And she says that she's seen Nabil around about 7, 8 o'clock in his van, dropping off medication, and the pharmacy closes at 6.
Yeah.
And he's staying behind and doing this, going out of his way. We have cases like Salwan in Leeds, at the pharmacy on Hare Hill Road, and Zoeb in Brockwood, doing handing out sanitizing gel, making kits free of charge for their patients, and this is all out of the goodwill of the individual pharmacy managers and their
Yeah.
teams, doing this. Many
It
people have,
also just shows how important it really is. You put the community back into community pharmacy. That wherever you have a community of people, there's always a community pharmacy there, and it shouldn't just be about where you get your meds from. It's how that pharmacy integrates itself into that community,
yeah.
and has more than just meds.
Yeah, and some pharmacies have been referral points where they're linked in with some local charities that are doing sort of deliveries for vulnerable patients, that don't that may have lost their income, lost that are struggling financially, so they need help with shopping. So a lot of pharmacies have been doing that. But just one point, you just reminded me on, and I've experienced it from, again, my general practice hat on, is the community in community pharmacy. There have been, unfortunately, a lot of cases where, the patients who have signed up to these distance selling massive online hubs around the country,
Yeah,
and their prescription normally goes to them. And yes, everyone has their individual choice, and I'm not necessarily knocking these these big hubs, but what I've experienced, and this could be anecdotal, it might not be representative of all of these hubs and stuff, is that um, because they've also been inundated, right? They haven't furnished those prescriptions, and they haven't then contacted the patients themselves,
yeah,
or they've given a part supply, and there's not been any communication whatsoever about
yeah,
the rest of the prescription, etc. And then nobody has been able to get through to these hubs, and then the community pharmacies in the community have had to pick up and take responsibility for patients that are normally not even their patients, to go out their way and help them in this situation. And for me, that just shows how
yeah.
important it is to support your own local community pharmacy over some of these hubs, in my opinion. Again,
Well, yeah,
that's from my experiences as a prescriber, because I've had, in the last 3 weeks, Saghir, many cases where patients of ours have rang and said, look, I use this X distance selling pharmacy that's, my surgery's in Lancashire, but they get their prescription from London, from Yorkshire, from Merseyside or whatever, and I haven't received it, and I can't get through to them, and or I've received one thing and I haven't received the three other items, and I'm worried.
yeah.
What should I do? And I've had to then reissue a prescription to a local community pharmacy, who have then gone out their way to help that particular patient. Um,
Yeah.
so that is, I don't know what your take is on it, because
No,
you're
no,
a
yeah.
lot of broader conversations.
Well, funny enough, you brought that up. There was something that I put on Twitter yesterday about this, and there was a bit of a debate. I've had experience of setting up. Well, not necessarily setting up, but when it came to the business planning of setting up hubs when I was at Well, and on principle and on paper, you can see where it makes sense.
Yeah,
You tend to put all your costs into one place. You tend to have a better ROI, return of investment, etc., etc. But there's a difference between goods going out and meds, right? If I order my shopping from Sainsbury's
yeah,
and some things that they just don't have, I can live without it.
mm,
Or they can change one item to something similar.
yeah,
You can't do that with meds, right? And it also totally ignores the fact that there's something really important here that we forget. The relationship between a GP and their community pharmacists around them is very, very important as well.
definitely. I've again, where I work. I'm just being honest here. There's only 3 pharmacies in that area. Two
Yeah,
pharmacies owned by a large multiple, and
yeah,
I mean, every pharmacy, putting the disclaimer out there, has been doing great work. There's challenging times, there's unprecedented times, and we're all dealing with it. But because of the one relationship I have with another pharmacy who I know will get their work, will go out their way, will get their work done. I know the pharmacy, I know the team. I have no special relationship with them. When another when a patient has an issue or can't get hold of stuff or whatever, because I know that pharmacy and I know they're going to do a good job, I suggest it. I say, look, this is a pharmacy that that normally do this, and they're pretty good. I know the team. Do you want to use them? And a lot of the times they might do or they might not. It's up to the patient at the end of the day. But because they've built that relationship with the GP surgery, not myself personally, but with the whole surgery and other surgeries in that area, we know that they're going to do a good job. We know that they're going to go out their way to get a prescription done. They're going to go out their way to make sure they communicate effectively with that patient. They're going to go and deliver to that patient, etc. And I just won't have that relationship with an online hub somewhere. I just won't, because I don't know who the staff are. I don't know who the pharmacist is. I don't know who the delivery drivers are. But at least with the local community pharmacy teams, I have that, and all of them. And I know some have a bit more flexibility than others. I know some of the bigger companies might not have. I'm just being brutally honest here. But it is what it is, I guess.
Well, the other thing is that when I was touching on about that relationship that you have, with the doctors and the community pharmacists, a lot of the times it's the community pharmacists that actually see the patients on a regular basis as well. And so just to be able to feed back to the GPs, just say, I've noticed X, Y, Z about such a patient. I think you might just need to keep an eye on them. You can only do that if you've got a relationship, and you'll only do that if you speak on a regular basis.
Yeah.
So having these large hubs, which are God knows wherever they are, and then you've got pharmacists that don't have any sort of relationship with the GPs and prescribers, totally takes that side of primary care working totally out of it. And to me, that's just a risk to a patient.
Yeah, no, as you mentioned, it makes sense from a lot of the times as well to have a hub that does this work, because you have one concentrated place, you consolidate your staff there, and a lot of the times, for many working people, it's an efficient service. So we're not trying to criticize and downplay its usefulness. It's just that in situations like this, you can see the pros of having a relationship with a community pharmacy in your area, and building a relationship with them, and from the perspective of a prescriber who's working in general practice, I see that benefit straight on, because when I know one of my patients has had trouble either with a hub or another pharmacy in that area, if I know of a trusted pharmacy in the vicinity, and I've worked with them and I've had good relationships with them, and they've given a good service all the time, on all different occasions in the past, then I'm more likely to suggest that service to my patients. But at the end of the day, putting the disclaimer in, I'm not saying go there. It's ultimately the patient's choice.
Yeah, true. But I'd recommend them using a community pharmacy. And yeah, well, last thing is to do with who qualifies for deliveries from a pharmacy. But really, I want to really centre it on what is considered high risk. So, Ghulam, you're a better place to answer this, because we were having this debate yesterday.
Yeah, I'm gonna find that article. Well, it's not an article; it's a document. Sorry. Let me find it. Right. So again, I'm just going. We're receiving different guidance all the time. Every week, we're receiving communications from the local area team on what to do, what not to do, etc., etc. But I think this has kind of stayed static. So the risk groups. So generally, anyone over the age of 70, regardless of medical conditions, or anyone with the underlying condition, that what you'd receive the flu jab for, you should practice social distancing and stay at home like everybody else where possible, and just go out for your shopping or urgent medical supplies and once a day exercise, right? So, but then you've got those that are very high risk groups. So I'm just going to read them out or just summarize them. And these are the people that should be shielding. Now, I want you to remember this word shielding. Shielding means that you have to stay at home. You can't go out. You must have people deliver food to you, deliver medication to
And
you.
the guidance right now is you shield for 12 weeks.
Minimum of 12 weeks,
Yeah.
or basically until further notice, right?
Yeah.
And so this is people who come under the category of shielding are those that are very high risk groups. And you should have received a letter from either NHS England directly, who have your information at hand, or the hospital trusts, or your GP surgery. So either from one of these three places, maybe even multiple letters explaining that you fall under this category. So these are people who have had an organ transplant, such as a kidney or liver transplant, people with a cancer who are undergoing active chemotherapy or radiotherapy, people with people with cancers of blood or bone marrow, such as leukemia, lymphoma, or myeloma, people who have immunotherapy or other continuing antibody treatments for cancer, people having other targeted cancer treatments which affect their immune system, people who have had a bone marrow or stem cell transplant in the last 6 months who are still using immunosuppressive drugs, people with severe respiratory conditions, including cystic fibrosis, severe asthma, and severe COPD. You should have received a letter from your GP surgery. People with rare diseases and inborn errors of metabolism that significantly increase the risk of infections, such as when you have a genetic disorder that makes you susceptible to having infectious conditions. People on immunosuppression therapies that reduce the risk of infection. So if you have an autoimmune condition, such as rheumatoid arthritis, Crohn's or ulcerative colitis, and you're on tablets that reduce your immune response, then again, you would have probably received a letter to be shielding right now. People who are pregnant with significant congenital heart disease, all patients taking any immunosuppressive medication, so just what I said earlier, and then patients with uncontrolled or very badly controlled or just complicated diabetes. So the guidance that we received in general practice was where their HbA1c, which is a marker in the blood that tells us how good their sugar regulation has been for a period of 3 months, their HbA1c greater than 75, or someone who's had diabetic ketoacidosis, patients with COPD, chronic obstructive pulmonary disease, who have required hospitalization in the last 12 months, or who have required 2 or more courses of a rescue pack, which consists of a steroid and an antibiotic in the last 12 months. So if you've had to use that twice over the last 12 months, you go into the high risk category. Patients with asthma with a history of hospitalization in the last 12 months who have been admitted into intensive care. So if you've had an asthma attack and it's been quite bad and it's required hospitalization. Patients with significant heart failure who have required hospitalization for their heart failure within the last 12 months. So if you have to go in over the last 12 months because of your heart failure symptoms. Patients with multiple long-term conditions. So my mother falls into that, for example. She's got multiple different long-term conditions and she's quite elderly. Patients who've had their spleen removed. Anyone that's taken continuous steroids to the equivalent of 20 milligrams of prednisolone or more for the period of 4 weeks or over. So if you've taken any sort of oral corticosteroid and it's a high strength and you have to take that continuously, you fall under that category as well. And anyone, again, that's on any immunosuppressive or immunomodulating medication, either in primary care or if you're receiving that in hospital. So you might, for example, go every fortnightly to get an injection infusion at your hospital as an outpatient. You fall under the high risk category. So it is a bit of an exhaustive list, but as you can see, it's to do with those that have very complicated conditions, or those that have uncontrolled, unmanageable, or I don't know what the right word is, but their conditions are not treated. They struggle with their long-term conditions, and those that are on medication that impairs their immune response. So generally, they're the groups of patients that should be shielding for a minimum of 12 weeks. But basically, I wouldn't even follow the 12 weeks until further notice. Stay at home. Have people drop off your shopping to you. Have people drop off your medication to you, and try your best to stay entertained and safe at home. I guess it's difficult. We've had to do that. For example, my third eldest brother, he's one of his children falls under that category, so he's decided to, sort of isolate, shield for a period of 3 months, and we moved my mother in with him, because it makes sense if he's shielding, she might as well be shielding with him, because she has a type of a blood cancer which is treated with medication, and she has diabetes and other conditions, and she's elderly. But I mean, they're not normal times, and it is difficult. I understand that, shielding is not something that any one of us would have thought we'd have to do, and none of us thought we'd be living like this right now. Our life has changed, but it's something that is worth it to protect lives and to obviously protect the NHS as well. So yeah, that's what it is.
It's the other thing I like to add to that is people who are shielding or who should be shielding. It's really important that they be really disciplined about this. It's hard. Even just a week of being stuck in the house is hard. But to do it for 12 weeks or more is immensely difficult. But you've got to be disciplined about it for your own sake.
Yeah.
So, as you just said about getting online deliveries or getting food dropped off to you, or if people need to see you to really do it through the window, it's hard when you're having to see, say, your mother or your father, or your grandparents, but you can only really talk to them through a window.
Yeah.
It's painful for the person who's shielding. It's painful for family members who are just checking over their parents or grandparents. But for everyone's safety and for us to be able to get over this difficult period, these are the measures that we all have to do. And
no, it's very difficult. It's not easy, and there are support lines that have been developed to support people emotionally during this period as well, because obviously it's going to have an impact on your mental health. But your local GP surgeries will have all the support groups, both for practical support in terms of for groups that are helping with shopping, helping with medication drops, and also any other sort of support that you might require. So if you call your GP surgery, the reception will have the details of all these different groups. So don't feel that you're alone. I'm isolated. I don't know what to do. I have no support. I have no family that can help me. If you fall into that situation, there is support out there for you. Just make sure that you call your GP surgery. Sometimes your community pharmacy will also have these details at hand, and they'll be able to help you and signpost you as well. And if you need any, if you are shielding, deliveries to you should be free of charge by your community pharmacy at this moment in time anyway.
And there's another thing here as well that you touched on everyone's mental health and their well-being, because it is a stressful and difficult time for everybody.
Yeah,
but we can all make more of an effort. And I think we have been. I think one of the really nice things that I've experienced, but also seen from others and heard from others, is how we've made an effort to be able to connect with others. So I have a great uncle who's having to shield. It's not too far from me. He's only in Rochdale, but I want to make more of an effort just to check up on him.
Yeah.
And so I know shielded. Would I have been as stringent on trying to be in contact with him before this? Possibly not. There might have been times when I thought, I'll speak to him later, I'll speak to him another time.
Yeah.
I feel as if I should make more of an effort. I've made more of an effort to have video conferences with friends which I haven't seen for a long time.
Yeah, I mean that's been the great thing about
But
it.
yeah, it's funny. We're being pulled apart, but we're also making more of an effort to be connected in one way or another. So out of all this craziness, it's quite a nice, beautiful thing that's sort of come out of it as well.
Definitely, and I wouldn't even just restrict it to family. I mean, my neighbours have been great. You know, they've been sending messages to each other saying, "Do you need anything? If you're isolating, let us know. We could pick up some shopping when we go over, get some
Yeah,
extra items for you." So, you know, utilize your neighbours as well because everyone's in it together. Everyone understands the situation we're in, and it's been really great. Sort of that community camaraderie, and and I hope once this is over that that continues as well. And I think you know there's going to be a fresh outlook to life, and we're going to all assess our priorities, and we're going to appreciate things that we never really appreciated or appreciated enough previously.
I hope so. In the past 3 years, the country's been torn apart, communities have been torn apart, families have been torn apart with Brexit,
Yeah,
those sort of discussions. And it's took a global pandemic for all of us to sort of be a
yeah,
bit more aligned together. And
yeah,
there's some good things that have come out of this as well. Take the horrible stuff aside. There's been some really nice things that we've all experienced and witnessed and felt, and
yeah,
important that we take that on board into our normal everyday life, whatever normal will be after the back of this.
yeah, definitely.
Cool. All right, I think we're pretty much done.
Anyway, let me double check the we haven't missed anyone. One moment.
Yeah.
Kind of, I don't know. We've answered that. We've answered a lot through discussion, haven't we?
Yeah, no, I think we touched on a lot, and I think we touched on things that we weren't expecting to on this as well.
Yeah.
Yeah,
How do I qualify for a delivery? Did you answer that?
that's all. Call your pharmacy. You know, they'll
Yeah.
they'll.
Yeah, we've received guidance on deliveries recently. So yeah, if you call your community pharmacy and if you have received a letter for shielding, you'll be automatically entitled to a free delivery. And if you're above a certain age and you've been asked to isolate anyway, where possible, we'll be able to sort of undertake that delivery for you as well. That's it. And what should I do if there's an outbreak in my community? I think it's the last one. It depends what they mean by community, don't they?
Yeah, not too sure. Anyway, if that happens, stay at home.
Yeah.
Okay, we've got to wrap this up now. Thank you to anyone listening. Thank you, Ghulam. And if you're listening, I hope it's been useful and you've been able to take some bits of information that are going to benefit to you. Thank you very much. Bye bye.
Thank you. Bye.